Staying active is one of the best things you can do for your health. But did you know that for some older adults, excessive walking can actually be harmful? While regular movement is beneficial, too much walking can worsen existing conditions, increase the risk of injury, and put unnecessary strain on the body. The truth is, not all seniors benefit from the same level of physical activity. In some cases, too much movement can do more harm than good. In this article, we'll explore 5 specific groups of older adults who should limit their walking to avoid serious health risks. From individuals with joint problems to those with heart conditions, we'll break down why certain seniors must modify their activity levels to maintain their well-being. Keep reading to find out if you or a loved one falls into one of these categories and what steps you can take to stay safe while remaining active. Number 1. Seniors with unstable blood pressure. For many older adults, maintaining stable blood pressure is essential for overall health. However, for those who experience frequent fluctuations, whether sudden spikes or drops, walking too much can be risky. Conditions like orthostatic hypotension, where blood pressure drops upon standing or walking, can cause dizziness, lightheadedness, or even fainting. On the other hand, those with uncontrolled high blood pressure may face an increased risk of strokes or heart complications from excessive physical exertion. Take Eleanor, for example. At 82, she loved her daily walks, but occasionally felt dizzy when standing up too quickly. One morning, while out for her usual walk, her vision suddenly went dark and she collapsed, fracturing her wrist. Doctors later confirmed that her body struggled to regulate blood pressure with movement. By adjusting her routine, staying hydrated, and using a mobility aid, she was able to stay active without putting herself at risk. If you or a loved one experiences dizziness, weakness, or fatigue while walking, listen to your body. Staying hydrated, walking with support, and regularly checking blood pressure can help prevent dangerous falls. In some cases, switching to low-impact exercises such as seated leg lifts or balance exercises may be a safer alternative. Number 2. People with chronic heart conditions. Walking is often encouraged to promote heart health, but for those with heart failure, arrhythmias, or unstable angina, overexertion can be dangerous. The heart works harder with each step, and for individuals with an already weakened cardiovascular system, excessive walking can push it beyond safe limits. Consider Edward, a 79-year-old man with mild heart disease. He enjoyed walking but noticed increasing breathlessness and fatigue. Thinking he needed to build endurance, he pushed himself to walk farther until one day he experienced severe chest tightness and dizziness. He was rushed to the hospital, where doctors warned him that his heart wasn't pumping efficiently enough to handle the strain. After switching to a carefully controlled exercise plan, he was able to maintain his health safely. If you or a loved one has a chronic heart condition, always follow medical guidance on physical activity. Pay attention to warning signs like shortness of breath, chest discomfort, or extreme fatigue. A balanced exercise plan can help keep the heart strong without overloading it. Number 3, those recovering from recent surgery or injury. While movement is crucial for healing, too much too soon can slow recovery and lead to setbacks. Whether recovering from a hip or knee replacement, a fracture, or muscle injury, excessive walking can increase pain, swelling, and inflammation. Margaret, at the age of 75, had knee replacement surgery, and was eager to regain her mobility. Ignoring her doctor's advice to take it slow, she pushed herself to walk more each day. Soon, she experienced severe pain and swelling, delaying her recovery by weeks. Once she followed a gradual, controlled plan, she healed more efficiently and regained her strength safely. If you or someone you know is recovering from surgery, it's essential to follow medical recommendations. Pain, swelling, or fatigue are signs that you may be overdoing it. Prioritizing healing over excessive movement can lead to a faster, more successful recovery. Number 4. Seniors with severe peripheral neuropathy. Peripheral neuropathy, a condition that affects the nerves in the feet and legs, can make walking dangerous. Numbness, tingling, and weakness can lead to poor balance and an increased risk of falls. Frank, a 78-year-old man with diabetic neuropathy, loved his daily walks, but started noticing a loss of sensation in his feet. One day after a long walk, he discovered a deep blister, but because he couldn't feel it, he had continued walking on it, worsening the injury. By the time he sought treatment, the wound had developed into a severe infection requiring extensive medical care. If you or a loved one has peripheral neuropathy, wearing proper footwear, walking on stable surfaces, and performing balance exercises can reduce the risk of injury. Regular foot checks and medical evaluations are also crucial to prevent complications. In some cases, switching to low-impact activities like swimming or stationary cycling may be a safer option. Number 5. Seniors with severe arthritis is common among older adults. But for those with advanced osteoarthritis or rheumatoid arthritis, excessive walking can worsen joint pain and damage. Joints in the knees, hips, and ankles bear the weight of every step, and when cartilage is already deteriorating, too much movement can accelerate its breakdown. Robert, 81, loved walking daily, but noticed increasing knee pain and stiffness. He thought pushing through the discomfort would help, but instead, his symptoms worsened. Eventually, he struggled with everyday activities like climbing stairs. His doctor advised switching to low-impact exercises like swimming, which relieved his pain and improved his mobility. If walking causes more pain than relief, consider alternatives such as swimming, chair exercises, or stretching. Supporting mobility without overloading the joints can help maintain activity without unnecessary pain. While walking is an essential part of staying active, it's not always beneficial for everyone. If you or a loved one falls into one of these categories, modifying activity levels and listening to your body can help prevent unnecessary pain and injury. Protecting your health isn't just about staying active. It's about staying active the right way. By making small, smart adjustments, whether reducing walking distance, switching to lower impact exercises, or using proper support, you can maintain mobility safely. Taking care of your body today means enjoying better health, more independence, and a fulfilling life tomorrow.